welcome, Viv. Thanks for coming to my podcast. I'm really happy to have you here.
Well, thank you very much for the opportunity to share. And before we start, can I just get your permission for me to tap? Because
Sure.
everybody knows I get very nervous and get very excited. And that's why patients call me the energized bunny. And I do behave like that. And sometimes got so nervous, even in other presentations, I actually start speaking Chinese.
Do you?
Well, because Chinese is my native language. And then, as you can hear, it's very short and sharp and fast. So by doing the tapping, I'll set up this space for myself to be calm. Is that okay?
I'll do it with you. You show me how.
Yeah, so this is just a very basic ones. There are a few different things like to do it properly. We do the setup statement here, and then you do it. So these are the points. You do it 7 times on each point. I already feel a lot calmer. Thank you.
Oh, there you go. Look, Viv, it's so nice to have you here. You are a consultant clinical pharmacist, and you're also a credentialed diabetes educator. And I know that you have worked with over 300 different doctors, including endocrinologists, obstetricians, GPs, as well as weight loss surgeons. And on top of all of that, you were nominated and you were actually awarded Pharmacist of the Year 2019 in Queensland, which is phenomenal. It's amazing. So I'm so happy to have you here because you've got a wealth of information that I know you're busting to share with me, and I'm dying to get out of you. So can I start with first, what led you to become a pharmacist? Was it always a childhood dream? Did you just fall into it? How did you become a pharmacist?
The childhood dream was actually to be a doctor. And this story might actually relate to your mission of preventing cardiovascular diseases. My own grandma, my father's mom, had 9 heart attacks. And I remember every single time when she come back from the hospital, she said, "Just let me die, stop resuscitating me." And I was like, my God, that woman's not grateful. But then later on, when I realized, go and visit her and talk to others, I realized, wow, it is very painful. And sometimes you're living in between being alive and dead. So I wanted to be a doctor, but unfortunately, I'm not very good with blood. So I always fainted. Whenever I see blood, I'm on the floor. So the advice I was given in high school was that, well, pharmacy is the next best thing if you can't handle blood. So that's how I became a pharmacist.
Right.
Yeah.
Wow. And you specialize in diabetes remission, de-prescribing, weight loss management, as well as mindfulness and breathwork. So if we put all that together, it's really such a holistic approach to helping people, isn't it?
Yes. So I'm very grateful for my upbringing in Taiwan. We immigrated to Perth when I was 15. And we've always used Chinese medicine because that's not alternative to us over there. Coming to this country, I'm very grateful. I got a very good education. That's how I can become the best pharmacist I can be, and still learning from a lot of other great pharmacists as well. But I do find, actually, I think 1 year after I was licensed as a pharmacist, my observation of patients that the more medication they take, sometimes the worse they get. And sometimes I find if the patient have one issue, like one drug, and that has caused the side effects, but they are not aware of that. So they go to the doctor just reporting the symptoms of other things, then doctor give them another drug. Therefore, they pile it up. And soon enough, one of the cases I've done, the patient was on 65 drugs. So she said to me,
65.
By the time I'm done, I am not hungry. I don't want to eat breakfast. So that triggers me to say, well, what can I do as a pharmacist to help? And that's why I look into doing accreditation for doing home medicine reviews, which I encourage patients. It's actually a free service from the government. Anyone with Medicaid, the GP can order it. But of course, please don't abuse it.
Yeah. So you specialize in weight loss. So if we start there, how are there people predisposed to more weight gain than other people?
Yes, I think, to be honest, there are like controllable factors and also the ones you can't control. Then, for example, certain races, like even some of my patients from like South America and some of the better turns Aboriginal patients, they do have that family history.
Yeah.
But then this research has shown us as well, the gene factor is less than 10%. So in a way, 90% is still in our control.
So 10% is a gene factor.
Yes.
And 90% is modifiable behavioral, is it?
Yes. Yes.
And so with weight loss, is there such a huge difference because it's such a cardiac disease risk factor of weight gain? You know, it increases inflammation, it increases your blood pressure, it increases the risk of atrial fibrillation, increases the risk of a stroke. So how do you help people with weight loss if it's not medication? What do you advise?
Well, as a pharmacist, medication has its place. But to me, a really good pharmacist is not only helping patients with the medications, it's also help to support patients outside the medication. So altogether, it's working well. So for example, for a lot of times patients come to me, they've already seen a dietitian, seen an exercise physio. They've been on the best diet they can be. And sometimes their diet is even better than mine. I'm like, oh my God, you put me to shame. Your diet is so much better than mine. And sometimes they will exercise so much that actually cause injuries. So for example, one thing I commonly say to all my new weight management patients, I say, well, how much exercise are you doing? And again, usually the amount they are doing is more than what I do. I do my half an hour exercise, walking and moderate intensity and all that. Some of them do a lot more than I do. I'm like, that's why you're not losing weight. And they were like, what? I've been told I need to do more exercise and eat less. Is the carry in, carry out? I'm like, no, that's not the full story. It's only part of the story. So for most of my patients, I actually say to them, I don't want you to actually walk any more than 10 minutes at a time. And I was like, what?
They'd be shocked.
Yes. Well, what happens is I used to do pain management. So people are known to people extra weight. Each 1 kilo is 5 kilo gravitational weight on your knee. So imagine somebody who's heavy, overweight, and they try so hard to walk. What do you think their knee is going to feel?
So every 1 kilo extra weight is putting an extra 5 kilos on your knees.
Yes.
And that's why you see people when they lose weight, isn't it? That all the pain in their knees go away.
That's right. And but I'm not saying to patients, don't do anything, sit there and do nothing. That's not right either. So I encourage patients to do a lot of mental exercise as well. But in terms of physical exercise, if they have any kind of pain, I get them to see a physio first to do functional tests to check out what's wrong. So let's fix the hidden cracks of the pains that you might not be aware. Because commonly we were told no pain, no gain, but I think that's actually outdated.
Yeah. And I think that's fascinating because I've just heard you say that you like them to do mental exercises. So can you please explain the relationship between doing mental exercises and losing weight?
Okay, the best story would be my patient yesterday. She just injured she had a fall last week. So therefore she could not walk. And she came in yesterday. She was so excited. She said, Viv, I can't believe this. I'm like, okay, can't believe what? Well, I couldn't walk. I was so stressed. I rang you up and you say, it's okay, just do this mental exercise. And I said, yeah, right. I've been keeping my sugar level good only because I was walking half an hour every single day in the morning and at night. And I had a fall. I injured myself. I could not walk. And you say, just do this. And what happens that she had a fall. Of course, she can't walk. So I just got her to do coursework and got her to do some editing. And I gave her a few articles to read. And I say, write a summaries for me.
So you got her to do a crossword and read journal articles or an article.
Yeah.
And
Well, to her credit, she is a book editor. I'm a retired book editor in the 70s.
So doing mental training, cognitive training,
Yeah.
was actually burning Sugar.
That's right. Like yesterday, she was so excited. You should see her face. I so want to bring her in today. She was like, I will tell my story. Her level waking up because she wasn't sleeping well with the pain. So waking up around 10 and then went out, having breakfast with her girlfriends and went up to like 18. She's like, oh shit. And then she kind of remember what I said. She was like, oh, but I can't walk. And then she just did all that yesterday and then, last week. And yesterday, that when she showed me the number, she said, I can't believe that before dinner, my reading was back at 5.5, the same as if I've walked in the afternoon.
Yeah, same as exercise. And the brain is so dependent on blood glucose. And I can remember studying, and you're using just as much energy studying as you are exercising.
Yes.
So it's all in theory. It's been proven.
Yes, I've done that for my students as well. Like I used to teach in universities a lot, and now I'm in clinic work a lot more. But then I am still offering like additional help free of charge to non-English speaking, medical students and pharmacy students or anyone who wants my help. And in exchange, I got them to wear a CGM for me, which I pay for myself. So, I'm not abusing any company's product. So I want to see the difference for me. And then what happens is, and also to educate them. So I could just say to them, look, during your exam, do whatever you want. The way you survive, eat whatever junk food you have, because a lot of them are overseas students. They haven't got the money to cook, the time and money to cook and all that. And so they just want to become a medical doctor. They would want to excel in their exam. So they just do whatever they can. But then what happens is we can see during the exam period, and I got them to do a diary for me, just quickly to say what they had. A lot of them have burgers because that's the quickest way they can do it. The numbers are so good. But the moment they finish the exams, the number went up.
Of
crazy.
their blood glucose readings.
Yes.
Even though they were eating burgers and just eating whatever junk food they wanted.
The number was good during the exam period.
Because they were burning that glucose.
Because they're using a lot of brain power.
Yeah.
So for all my elderly patients or anyone with any injuries who can't exercise, I said, hey, I'm not saying don't exercise.
Do a crossword instead.
Yeah. Move your arms, move your legs as much as you can, but don't force yourself out there if you are not able to do it, because the more injury you have, the worse your sugar level is going to be. So, yeah, exactly. Just do whatever slightly challenging mental exercise here. And this is what I say to everyone.
Okay. So what about the myth that we've always been told you are what you eat? What are your thoughts on that?
It's not entirely wrong, but at the same time, it's not entirely correct. Let me share an example. One of my patients is, apparently she's very high profile in her world. I wasn't told. She told me that. But what happens is she needs to keep a very nice shape. And then last year she came, and she just could not achieve that anymore with her breathing, exercise, and eating only 800 calories.
Gosh, that's a very limited diet, isn't
Yeah,
it?
so she was starving to death. She was eating next to nothing, and she was doing like 2 hours training. So the first thing I got her to do is eat more. I make her eat 1,200, and she nearly died. And I actually said to her, I don't want you to do any more exercise than 10 minutes walking after each meal. And she said, I don't have diabetes. I know that's what you do with diabetes patients. That's what my sister did with you. I'm here to lose my weight. So, well, first of all, I actually don't like the word weight loss because we humans don't like to lose. The more you want to lose, okay, that's from your head. Your body says, no. The
Right.
fear of that.
Yeah.
Yeah. And then what happens is then your body will try to preserve that because her body is already in like starvation mode.
So you're getting her to eat more and exercise less to lose weight.
Yes. So what I did for her, we can tell like she's obviously got severe like body image issues, right? Because she's a beautiful, stunning girl in her 20s. And I make sure she doesn't have any other mental health issues or disorders. Like that was all checked out by another psychologist to make sure she hasn't got that. It's purely for her job. She needs to have a good figure and certain number. So I just got her to start doing some mental exercise as well. And for her, it wasn't reading, it was actually painting. She actually loved painting. So this is one thing I do with patients. I give them all these other so-called alternative things to do. Because she was so stressed about her work, so stressed about her figure, I got her to do 1 minute meditation, 1 minute mindfulness, and 1 minute breath work to calm her down first, and also a little bit of tapping.
Yeah.
And right away she said, oh, I feel so much calmer. I said, good, okay, now let's do this. And then we just bring out her childhood memory, where the issue is and stuff like that, and then slowly clear each one. And then also at the same time building her up as a woman. So she doesn't have to be that little girl who's too fat and doesn't look good.
Right. So you're going beyond just the food and the exercise. You're actually going into mindfulness, breath work, going back to childhood trauma.
Yes.
And breathing. And what was the result of this woman, or is it still ongoing?
Well, the result of this woman, I don't see her anymore, and she doesn't need to see me anymore because she's learned to appreciate herself. And well, I called her yesterday about today's podcast.
Yeah.
She said, yeah, you can share my story. She's now eating sometimes up to 2,000 calories, which is double than what she has.
Yeah.
She does a lot of mental exercise. And now she appreciates herself to the point that she's comfortable letting people see a little bit of her cellulite. Even so, to me, there's no cellulite. The confidence is back. And she's now actually gone back to uni and pick art as her subject to do.
Wow, that's brilliant. So it actually feels good about herself too now.
Yeah, so that's my aim of giving the power back to the patients to empower them to say, hey, this is just a symptom of something. And most likely is your life.
Yeah. You also specialise in insomnia and stress. And insomnia and stress really go hand in hand too, don't they? And they're both cardiac disease risk factors. So stress is, long-term cortisol release, that chronic underlying stress, which sets off inflammatory markers, which damages the endothelial lining of coronary arteries. And in terms of insomnia, I think we live in that sympathetic state all the time of thinking, and life is so fast that it's hard to get people to relax and unwind during the day. So can you take us through how you help your patients with insomnia and stress?
Yep. So, for example, I worked with one of a PhD student a few years ago. So, of course, PhD is not an easy job to do, right? To do all the
No.
research, write a paper, have to answer to all the panels and...
There's stress right there.
Yeah. And then she's so close to the end, but she had burnout. She just couldn't do anything.
Oh,
And the poor girl could not sleep. Like, she sleeps 2 hours a night.
wow.
And she was taking all these over-the-counter medications, seeing other people and talk. Like she did the right thing. She went to a psychologist and talked about it. And the more she talked about it, the more she can't sleep. Long story short, she only came to see me after she came to an appointment with her grandma, who has been on medication for sleeping for 30 years. And by using all this mental exercise and EFT, her grandma's off medication for 6 months.
Just explain EFT to the audience, please. What is that?
So it's called emotional freedom technique. So using acupuncture points and also a little bit of behavior cognitive therapy in helping to reframe, but without the therapist telling you to reframe. Like, you will actually naturally come to it when you sync your head and the body together. So we did a little bit of that, but the main thing is actually, again, to help her to find the stress about handing in her paper, doing all the research, and sleep hygiene and all these other things, and also eating, because she was eating just before she goes to sleep. That's the only time she's got time to eat. And it's like, 11 o'clock, I better go to sleep, and because she start early at 4 or 5 o'clock.
And your body's trying to do rest and digest,
Yes.
let alone if it's a sugary item, you've got all this glucose sugar running, I'd be wired till 3 a.m.
Yeah, and that's why she could not sleep, the poor girl. So I just got her, what we did is, again, mental exercise, got her to do the breathing. So she tried a few different breathing techniques already with other people, but all I teach her to do, okay, let's breathe in 2, and then breathe out 4. And I also get it to do with her hand so that she can visualize. Like, okay, breathing all the good things. 1, 2, out. And as she does that, I ask her to visualize all the stress is leaving her body. And after doing this, I think, and also if you like the meditation and mindfulness part to say, okay, I want her to imagine she's watching a cloud. And then just imagine all her thoughts in her head is floating away with the cloud, just like that.
Yeah.
And after doing that, literally she says the first night after doing that, she zoomed out and had 5 hours sleep the first time.
5 hours from 2.
Yes.
That's amazing.
And not only that, her blood pressure, gradually her blood pressure become better. So we then approached her GP, who happened to be very open-minded. He was like, "Wow, I'm glad your blood pressure has dropped. Yeah, let's drop your." So now she's off antihypertensives. Before that, her blood pressure is constantly high.
Yeah.
Because of the stress.
Because of that sympathetic system,
Yeah.
which vasoconstricts. And so you're getting her to engage in that parasympathetic, that restful stage. And with the breathing, isn't it? Is when you breathe twice in but 4 out, you're really engaging in that parasympathetic, isn't it? Winding down, relaxing mode.
Yeah. So she's not in that fight and flight or freeze. Oh my God.
Yeah, wow.
Yeah.
That's amazing. So why is insomnia so prevalent? Do you see it on the rise?
I see in 1 in 2 of my patients.
1 and 2.
Yes, and they don't have to be old people. This is a misconception. A lot of people thinking it's only the old people who can sleep. I'm like, that's actually not correct. A lot of young people can sleep. And I also want to just misbusting the fact that, once you get older, you can't sleep. That's natural. That's not natural. That's not how it's supposed to be. Just like our cognitive function and heart attacks, old people do not have to have that. Sorry, I should not use the term. My patients will get upset. Elder patients.
Yeah, not old people, elderly.
Yes, sorry.
Yeah. So young people and old people both suffer
Anyone.
with insomnia.
Yeah.
Yeah. And again, do you think it's society? Do you think it's social media? Do you think it is work-life stress balances, family stresses, all of the above?
Yeah, and also being self-critical. So one thing I teach all my patients is that I want you to figure out, and of course I work with them, where do you think you're not good enough? And they was like, what do you mean? I said, the reason you don't sleep is that, I haven't finished this, I haven't got enough time, I haven't got enough this, that. But ultimately, that's coming from you not feeling enough. Therefore, you need to do more to prove to others you are good enough. You need to make sure you do all this to make sure you are good enough. So one thing I help them is for them to gradually figure out where they are already good enough. And when they become in that state, they are more empowered. And when they're empowered, they just do more without us pushing them. And so that's why in my clinic, I don't motivate people, because when you motivate, it's like coming from outside. They'll do it only so far. That's why most people, they go on this diet and other things. They do it for 6 months and they go through the yo-yos. They feel so bad about themselves, and the guilt and the shame, the cycle is so disheartening. And then so I break the cycle to say, okay, it's not 100% your fault.
I think because people are always aspiring to something, isn't it? Rather than feel the gratitude within of the present, it's always, I've got to aspire to do this. I want to be that. I want to be that. And only when I get there will I have pleasure and joy. But instead of finding the pleasure and joy in the present, isn't it? Yeah.
And this is why I teach patients. I said, right now, you're not happy. You're not going to be happy even when you manage the 10, 20 kilos weight off. Rather than saying, I can only be happy when I'm less than 100 kilos for most men. For ladies, it's usually the figure of less than 60. I don't know why they've got it on there. To me, it's your health. It's not the fitness. And also, what do you want out of your life? And they was like, oh, you're the only one that's saying that. I said, well, because for me, I know 10 years ago when I started as a diabetes educator, I didn't know where to go, and there was no position for me as a pharmacist diabetes educator. But lucky for me, I have a coach, Mari. He gave me a few different mental exercises to do. I'm like, wow, this works. That's part of the reason I want to become a life coach myself. So I use a lot of coaching in my practice to help patients to see the bigger picture from the top down.
Yeah.
Like, okay, why did you want to lose weight? If they would want to use that. That do you want to be able to walk longer, climb the stairs, play with your grandkids, or you want to look good in a wedding, or you just want to be able to enjoy your life and be here for your family. And just and then so from there, when I draw the inspiration from them, they'll keep on doing it. I do not have to push them at all.
No, you're just helping initiate it from within.
Yeah, and I believe we are all genius in some way. And just like you left behind a big paycheck. That would be a very cushy job everybody else would want to have, right? You left that comfort, come out to do this because you're on a mission. Just like me, on a mission to get all my patients remission.
To prevent cardiac disease.
Yeah. And this is why I'm so grateful for today's opportunity that I just feel like we are so aligned in this. We all talk about prevention being the best medicine, but who's doing it?
Absolutely. So now I want to talk about diabetes. You did touch on diabetes and you are a credentialed diabetic educator. So can you please, let's just go to the basics, just talk about type 1 versus type 2. And I know type 2 is way more prevalent. And studies have shown that when it is a silent disease and it's a massive cardiac disease risk factor, in fact, people aren't even aware that they've got diabetes. Sometimes they're quite asymptomatic. And also studies have shown that by the time they're diagnosed with type 2, that 50 to 60% of the beta cells that produce insulin are already damaged. So can you speak to me about how you help your clients and managing their diabetes, because I know that you've had great success also in diabetes remission with your clients as well.
Yes, I thought probably best way to illustrate that I have a story which also coincides with your blog. Right. It was a CEO and I have got his permission to share. He already had 2 heart attacks and it was only after the first heart attack he realized he had diabetes. Before that, he didn't know he had diabetes.
There you go.
And he's a very intelligent man. He manages a big company with hundreds of people under him. So he's very smart, quoting his words. I'm a smart man.
Yeah.
I'm like, good. I'm glad you're smart. But not so smart with your body. He just looked at me like this. I said, yep. Why are you here? Well, apparently you can help people in remission. I said, look, I make it very clear, just like de-prescribing. I cannot promise anything because we are all different. But one thing I can promise is that your life will be a lot better. You will feel a lot better about yourself because I'll teach you how to re-empower yourself and then change your life outlook rather than focus on the disease. Because I think with Western medicine, there are so many advances in Western medicine, which is great. But at the same time, all the specialty, we cannot cut this person up. They become this disease, that disease, that disease. For me...
Siloed.
Yeah. For me, all these numbers, I don't see the numbers. I see the person in front of me. And just imagine they got all these plates and all these things on his plate, like his work and everything else. He's got no time for that.
They're all interrelated.
That's right. And
like diabetes is a 2 to 4-fold risk of having a heart attack to a non-diabetic.
And if we can manage their stress, their sleep, their weight in the first place, that's a real prevention there. But the thing is, I also see it from my medication reviews, the adherence to type 2 diabetes medication is less than 50%.
Hang on, the adherence to type 2, their compliance.
In my experience. Because, as you said, diabetes is a silent disease unless you have type 1, which is different because you will die if you don't inject your insulin, so they will do it. But type 2 is the most they say, I just feel a bit tired, I just go to the toilet a little bit more, I'm just a bit thirsty. So they don't feel the difference. Whereas asthma patients, their adherence is up to 80% because if they have an asthma attack, they know they can breathe.
Yeah.
Right? Or patient with heart attack, usually the first 6 months after heart attack, after cardiac surgery, they are very adherent to the drug because they remember the chest pain, the horror. And I'm sure you see that in your
They've had the event.
No?
Yeah. Tell me what to do.
Yeah. But after 6 months, blasé, and that happens. And this is why, I say to patient, I say, look, diabetes is a little bit like the silent flood. It's coming gradually, but you don't see it. Where's your heart attack? Like this CEO, he only becomes serious about this after a second heart attack. Because he's under so much stress, but business is more important. And as he said, if I'm not here, then, the whole company fall apart, and I'm responsible for over hundreds of people's livelihood. So he put, like everybody else, before his own. But long story short, he was really struggling. And what brought him to me was one of his employees was my patient, and I helped her to get into remission. So he came in just demanding, I want to be in remission. I'm like, I'm sorry, nobody can promise that, but I'll teach you what you can do in addition, because he's also doing the right thing, doing the traditional standard care. He has got a dietitian. He has got a cook to cook the food the dietitian gave him, like the meal plans and stuff.
Yeah.
He goes to a personal trainer, does his personal training. He makes sure he relaxes. So he has like spa treatments every week. And he has a masseur. And he even have a psychologist session every week to de-stress. And his sugar level is still high.
Right.
Yeah. But he hasn't got time for meditation and mindfulness. So again, I just taught him those simple ones. And this is a misconception most people have. Oh, you got to sit there for half an hour. I'm busy enough. But no. Mindfulness is to teach you to calm down. So I just got him to start washing dishes.
To what? Wash dishes?
Yes. And he was like, I'm a CEO. I said, at home, you're not a CEO. And this is the best time. So mindfulness basically, I don't have a long version. For me, you can tell I like short and sharp and straightforward. Yeah. Because English is not my first language, and I make it easy for myself to remember what to say. When you wash dishes, you don't have to think. And I say to him, I want you to feel the water. When you're washing the dishes, I want you to feel the hot water, cold water, the grease on your bowl. And then after you wash it, I want you to feel how clean they are and how good you feel.
You make a tedious job sound so wonderful, but it's actually getting him into the present moment, isn't it?
Yeah.
Like you're getting him it's that subconscious mind that is not even thinking about it. You're getting that whole act of washing the dishes into the present conscious, isn't it? Feel the water, feel the temperature. Yeah, classic.
And the best thing is that's the start of their relationship become better. Because he's been so busy, so he neglected his wife and children because he wants to be able to provide for the expensive holidays. But the wife wants him to spend time. Mm-hmm. And so this is one thing I teach all my patients. I say, look, I want you to spend time after with your family after reading a book. I can't remember. I did remember. A book by a nurse who works on oncology, the 5 regrets that people have. And number one thing, nobody ever regret that they spend time at work, okay? They regret they spend too much time. They don't regret they spend too little time. But everybody regret not spending time with their loved ones. So my question to all my patients is, who do you actually love? Your work or your family or whoever you say is your loved one? And so in a way, that's helping to build up the support system for the family, because now the wife was also engaged because now she's got a husband that's washing dishes for that, which never had happened for last 30
For the sheer joy of washing dishes.
Yeah, and then so appreciative, start really being appreciative of her food. And, rather than saying, oh, you're not a chef, I'm not eating your food. Like, this is not healthy for me. So now they actually have a family meals.
Okay, but how's that helped his diabetes?
Yep. So what happens is he was also having a few issues, and after the 2 heart attacks, he was having erectile dysfunction. He was having
precursor to heart disease.
That's right, and then kidney issues, and he nearly went on dialysis. That's how bad he is. He's really in a bad shape, and then he's got diabetic neuropathy. Like his feet was burning. So, and I said to him, look, you are doing everything else you could possibly do, but we need to get you to adhere to your medication. And he did. But at the end, he was just like, I'm not getting anywhere. Mentally, he hasn't done any work. I just said to him, look, let's relax. Don't do all these extra trainings. I want you to just sit there, wash the dishes. And I want you to really be there for yourself. And I got him to start looking into what he enjoyed doing and spending more time with family and spending more time in nature. And then gradually, he's not pushing, he's feeling more relaxed, and he's sleeping better with some medications.
Great.
And then I will be honest, it wasn't overnight like this, okay? It was over 12 months we got him here. So long story short, he's not in remission because he's still taking medication because the definition is that you need to be off medication for minimum 3 months.
Yeah.
Your HbA1c has to be less than 6. His HbA1c is around 6. I did get his permission to share. But now he's only on 1 tablet.
Reduced.
Yes, and he compared to large doses of insulin that he was on.
So he was on insulin and oral medications,
Yes.
and now he's stopped the insulin, he's just on the oral medications,
Yeah.
which is a huge improvement.
Yeah, and then his blood pressure and everything, all the measures just came down. And so unintentionally, we managed another 15 kilos for him.
Right. Okay, so was the weight loss of the 15 kilos through exercise or diet, or was it by doing other things?
I think it's by doing other things because he's already tried the standard things that we do. And I'm not saying standard things doesn't work. They do work to a certain extent. But as I mentioned, the childhood trauma and also the nerve, how tight his nerve was.
Yeah.
And by relaxing, doing this, and be a husband again, be a father again, he got his life back. That's what he said. He says, thank you for giving me my life back.
That's amazing success story.
I'm just very grateful.
So what would you call a HbA1c level, which for the audience is blood glucose level of, and it's looking at greater than in the last 3 months. So in HbA1c, what level would you be concerned at? Is it greater than 6.0 or 6.5?
Well, the definition, once your HbA1c hits 6.5, you are diabetic. I mean, now we say people with diabetes, but I say to patient, like, once you get, so from 6.5 onward, you should have treatments. So usually we start with lifestyle, and they are pushed first to start even medications, depending on individual and their work schedules and everything. Some medication works, some medication they might have trouble because some of them can get diarrhea and stuff, and that's not convenient at work. Then you'll have to do other things. But if your HbA1c above 7, probably a good idea to see a specialist just to make sure and check everything else out. And I do say to patients, ideally, make sure you have like regular blood tests as well as a urine test to check your kidney function, because that's one thing that's sometimes underestimated. And one thing, and I know this is probably different to what other people think, I personally don't think HbA1c is a very good indicator because it's only an average of 3 months. So I say to patients, just like, for example, Queensland, you look at the average rainfall, we are the best state in Australia. But it doesn't show you the flood and it doesn't show you the drought. So when you average out, it looks perfect. So this is why I say to patients, I don't want you to stress yourself out to check it every single day, but every week. If your level is not less than 6.0, I want you to check a few times so at least you can find out where the pitfall is and then start doing it.
Yeah. You also specialize in de-prescribing medications, and I heard the story of the person that had 65 medications. Is that often that you see people are over-prescribed? Because I do know that roughly around 4 to 5 to 6 medications all can contraindicate each other and have side effects. So have you got a success story there as well, where I love your stories, by the way, so
thank you.
of de-prescribing or minimizing, reducing medications?
Yeah. So, for example, one of the biggest success story was a lady. She's in her 40s. She had a fall working in hospital. And therefore, and this is like a while back. So way back with pain management, we do equivalent dose of whatever medication you're on to the morphine equivalent. So she was put on a few different opiates because her pain was severe. She broke a few bones and was in surgery.
Yeah.
And what happens then, because she was depressed, then she was put on antidepressants. And then because she had the side effects from antidepressants, then they put on something else. So long story short, she started with no drug. After that severe fall in hospital, she ended up with 20 medications, and she went from a very slim size 6 to a size 18.
Gosh. In what time frame was that?
2 years.
Yeah.
And by the time I was asked to go and review her, it was another 5 years. And she's gone to size 20 something. And she was in a wheelchair. When I first working, I was looking at everything. I'm like, well, why is she in a wheelchair? Her body is able.
Yeah.
And yeah, first of all, because she's too heavy from taking all these opiates, which stimulates your appetite. And also because they can be addictive. So even though her pain improved, but she's taking more and more and more. And nowadays we know opiates actually sensitize your pain and make you feel more pain. And this is part of the reason we have the prescribing guideline for antidepressants and opiates and stuff, apart from the risk of
opioid-induced hypersensitivity or something.
Yes, thank you. Yeah, so as I mentioned, I'm not very good with the long.
Opioid-induced
Plasia.
hyperalgesia.
Yeah.
Something. Can't remember what it is.
I know this is my short form. I'm very good with the short forms.
Yeah.
So this is why proactively now the government has actually also changing, the prescribing guidelines as well. See, way back, people can get Masendo over the counter, which have codeine in it because it's only a smaller dose. But now you can't get it anymore because of the overdose and the death on the streets. And so for this poor lady, she showed me the photo. Literally, the before after was shocking. And long story short, I put a plan to the doctor to say, this is how we slowly taper her off and then get her specialist support, especially in her mental space, to reduce her antidepressants as well, because she was put on a few. I was quite surprised to see, why would you put on a few when, give her alternative, and then get her to start doing mental exercise, breathing. And the number one thing she said, when I call up later just to see how way back we don't do follow-up, but now we can. But way back I just do it myself anyway. I don't wait for the system to say, you need to do follow-up. I just follow up my patients anyway. She said, oh, thank you for helping me to reduce the medication. I'm sleeping so much better even with the reduced medication. So she has the confidence that her pain is not going to be there. And I also teach her about pacing. So, the boom and bust. Like when they feel good, she go and clean the house and then boom, bust. 3 weeks, she cannot move. So I teach her about pacing, how to do gradual things. And then from there, she sleeps better, she feels better. And I just then got her to start slowly moving her arms and legs, even when she's in the wheelchair. Long story short, now she's back to around size 14.
Brilliant.
I personally don't go by the weight because the weight will control patients' feeling. Oh my gosh, shit, I'm 1 kilo heavier. What's the point? They go and eat. Oh, you're like, oh, I'm 1 kilo lighter. Oh, I can celebrate. They go and eat. And ultimately, they come back to where they are. And I say to patients, well, the scale is lifeless, and yet you let that control how you feel the whole day. And let's face it, your weight is not going to drop. And I say most of the weight that you did drop is probably water because you are actually dehydrated. I can see in your face and in your skin. They say, oh, yeah. So this is part of the reason I say to patients, I actually don't weigh patients at all. My weight clinic has no scales. But I get them to use the clothes, and if they really want to measure anything, it's a waste. Because as you know, the fat in the abdominal area are also high risk for cardiac issues.
It is.
So for my weight management, I focus on the waistline more than anything else.
And so do you get your referrals from GPs? Because I hear that, you're collaborating with the specialists and the GPs. So is that where you get predominantly your referrals from, is the GP?
Yeah, most of them, yeah. But I do have quite a few patients that coming through self-refer now. Just like the patients that after seeing the grandma, the young pretty girl, she come for can you help me with my weight? And then at the end, it wasn't her weight was the issue. It was the fact that she's not sleeping. And if she's not sleeping, the body is not repairing, because that's the only time the body has time to repair ourselves.
So the patient doesn't need a GP's referral to see you. They can see you directly, can they?
Well, if they see a GP and if they have diabetes, under Medicare, diabetes education, they can get some rebate. I don't bulk bill. I used to, but because I was getting so busy and patients start saying, look, I'll just pay. I'm like, oh, people want to pay. All right. So I start, charging and But then if they, for diabetes and other things, for non-diabetes related issues, because at the moment, there are no funding for me because I'm not a psychologist. I'm independent, so it will be just all private consults.
Yeah.
But as patients said, they said, look, what you help me in a short time, up to 12 months, is better than my 20 years in therapy. So it actually works out a lot cheaper.
So do you incorporate breathwork, mindfulness into all your patients?
Yep.
And this EFT, the emotional
freedom technique.
Freedom technique.
Yeah. So what I do is I need to make sure as a licensed health professional, I do what I need to do as a professional first. So I give them all the advice that I can, like, how to minimize, I give them education about what diabetes, the difference between pre-diabetes, type 2 and type 1, because patients sometimes get confused. They say, oh my God, I'm on insulin. That means I'm type 1 now, so I can get a CGM. I said, no, it doesn't work that way.
Yeah.
So I explained to them, and then I teach them about potential complications, for example, heart attacks, cardiac issues, kidney, and all those things. And then teach them why, type 2 diabetes is so prevalent, what's going on. And then after that, I reassure them to say, look, you're here, we can do something. And I'm not going to sugarcoat your diabetes. Let's just go and fix it. But these are the things you can do, like dietary advice. Of course, specialized people with any specific GI tract issues, I send them to specialized dietitians. I've done a postgrad in nutrition, so I know where my limit is. So I give them dietary advice as much as I can within my limit, and I teach them how to use their medication as a clinical pharmacist. And my ultimate joy is to say, how about we try something else? And ask them about their stress, and if they're open to it, and I say, well, these are different tools, and I will demonstrate and say, which one would you like to try? And everybody has different preference, and sometimes they say, nah, this doesn't work. I'm like, okay, we try something else. But ultimately, you make it easy, then they can do it. So my thing is always, I just want you to do one thing, and then 1% better today.
You're in that perfect category of preventative health practitioner, and also collaborating on either side between the patient and the specialist, or the patient and the GP. But to have somebody like you in their pocket, helping with prevention and behaviour modification, very much aligns with me in terms of cardiac disease prevention as well. And just for people to be able to have that type of a specialist sitting between them and the GP, for example, because we can advocate both ways, can't we? Mm. It's a great position that you're in, and you've got this wealth of experience.
Yeah, I definitely think this is one thing I encourage all your audience as well. Like, there are plenty of people who can help you out there. Don't think you're the only person, and don't beat yourself up, because you don't know it, and therefore it's not your fault. But the worst is knowing it and not doing it. And again, life, as you mentioned before, life is so busy. Society is so busy. Fast, fast, fast. So what I teach patients is literally what the phrase I've learned before: slow down, smell the roses, and ultimately listen to your body. And this is one thing I've emphasized the last almost 30 years as a clinical pharmacist to all my patients and students. Your body is the best doctor. It's not your enemy, okay? So listen to it. If you don't listen to it, just like the CEO, first time a small heart attack, nah, I can still play golf. Second time, he nearly died. Therefore, he becomes serious. I say, but do you want the alarm to sound so loud before you hear it? So listen to your body.
Yeah, that's exactly what I say. In terms of, I say that the heart has more wisdom than the brain. And by listening to your heart, because your heart talks to you, the same as it's the body, talks to you every day, all day. We've just got to slow down enough to listen. And most of us are so in our heads we don't listen. So the heart talks to us a little bit louder and says, hey, you got to change, you got to stop smoking or do a little bit of exercise or watch your weight. And again, we don't listen to the point that it gives you a cardiac event. And only then do you stop and go, oh, okay, I'm ready to listen now, because it talks to you all day. And I think that's the common message that you and I and a lot of private practitioners talk about is our heart and our bodies talk to us all the time. We just got to listen.
Funny enough, that's actually the main thing we do in Chinese medicine. I also study Chinese medicine. Chinese medicine, we say the brain is only the servant to your heart.
Correct. Yeah. And the heart has afferent nerve fibers that run to the brain. So there's more afferent nerve fibers that run from the heart to the brain than there is from the brain to the heart. And that study's done by Heart Maths, and there's hundreds of independent studies showing that. So it's just amazing. And then I say, well, who's the boss then?
Yep. So one thing I teach my patients, the quickest way, and also I demonstrated in a recent event that I was invited to actually present at the ICGP accredited program to talk to GPs about chronic weight management. And funny enough, the topic was beyond pharmacotherapy.
Oh.
So I was actually doing a tapping demonstration and teaching the doctors, if the patient's in tears or in distress, just to hug themselves like this. And some doctors came out to me at lunchtime to say, oh my God, I feel so good. I feel like I was like a baby. I said, well, look, exactly. Go and watch little kids. If they are hurt, like they actually go like this. And then you go into a fetal position like this. And that's our body's way of self-soothing without medications and drugs.
And you watch children do it, exactly what you're saying.
Yeah. So this is why I say to everyone, look, listen to your body, slow down. And your body will guide you through it.
So, Viv, I'm going to ask you a few personal questions now. Yep. What do you do to maintain your optimal health?
Okay. This will be very... Okay. Because I like you, I'll share. I spend a lot of time watching cartoons.
Do you? I love hearing these personal stories.
Because I find when I'm watching cartoon, I become that little girl again. But then knowing what I know now, because I do a fair bit of inner child work as well. And I'm working through my own trauma as well. Like my trauma is not traumatic like some of other patients, but even little things can be traumatic still. So I'm working through that, and I find by watching cartoons, I kind of back in that space, I can help myself to recover. And that gave me this energy. And then whenever I go back to Perth, and I definitely make sure I play with because I don't have kids myself, so I play with my nephew and my niece and just enjoying the time. And I think the common things we all like is a lot of play. And watching cartoon is my number one thing that I can do without anyone else.
And if somebody wants to find you, because you're a private practitioner, how do they get in contact with you?
Yes, so I do have a website. So it's www.vipdiabetes.com.au, and you can contact me from there.
vipdiabetes.com.au. Lovely. Thank you so much. You're just a wealth of information. I've really, really enjoyed talking to you today, and I really appreciate the space that you're working at, being an advocate for both and a collaborator between both GPs, specialists and the patient. It's such a needed industry that love hearing about you, Viv, and just appreciate the work that you do.
And thank you for the opportunity to share, because I think it's very important we help the patient to break the vicious cycle of shame, guilt. For example, like the CEO, he was feeling so guilty about not being a good dad and also not being a good husband. But the moment he started washing the dishes, his world changed.
All it took was washing dishes, isn't it? Crazy.
And I know, interestingly, I went online to search. Apparently, this is just on Google, so don't quote me on it. Bill Gates also wash dishes.
What's it called?
Oh, Bill Gates.
Oh, Bill Gates.
Yeah.
Oh,
Oh, online. That's what I said. Like he also wash dishes to assist
right.
meditation.
And who would think that just doing dishes, but yet it's been so successful for your patient and Bill Gates?
Yeah. So, and this is why I say we are all genius in some ways, but we are covered by what's out there.
Yeah.
So if we go inside, do the inner work, and pull out the inspiration, and you can be the genius that you are.
Thank you so much. It's been a delight.
Thank you.
If you like this podcast, please share, like, and subscribe. Also come and visit. The website is heartcoregroup.com, and we're also on Spotify, and YouTube is Heartcore Junction. Thanks so much for watching. Until next time.